Heart arrhythmias are irregular heart rhythms that result from changes in the heart's electrical system and are categorized according to their location. Ventricular or supraventricular heart arrhythmias place people at risk for stroke and sudden cardiac death if left untreated. Atrial fibrillation is among the most common of heart arrhythmias. It has a high mortality rate due to higher incidence of thromboembolism. These blood clots form because the heart is unable to move blood fully from chamber to chamber. AFib also leads to changes in the dynamics of blood flow, such as elevated blood pressure. Heart failure can also occur, as insufficient pumping can cause blood to back up in the heart and cause fluid buildup in the lungs. AFib is defined by the occurrence of disorganized random electrical signals that occur in the upper two chambers of the heart, causing the atria to quiver and contract rapidly and irregularly. This irregular contraction of the atria causes the lower chambers to beat more rapidly and irregularly as well. Treatment approaches include antiarrhythmic medications, procedures like cardioversion, where electrical impulses are sent through the body to restore normal sinus rhythm, and recently the most popular, catheter ablation, which is also used to restore normal sinus rhythm. This procedure involves guiding a tube into the heart to destroy small areas of tissue using radiofrequency energy that may be causing the abnormal heartbeat. Catheter ablation has become the most focused on approach for patients with symptomatic drug refractory atrial fibrillation, or AFib, that cannot be treated by drugs or cardioversion. Different approaches for catheter ablation exist, and their efficacy has been tested throughout the years. The most important question that arises is whether ablation simply slows disease progression or confers relatively stable long-term arrhythmia control. In 1994, Hayes-Garrett and colleagues were able to perform a successful catheter ablation of typical AFib using linear lesions performed by sequential applications of radiofrequency energy. They made these lesions in the right atrium to reduce the potential consequences of eventual thrombi formation. In their procedure, two catheters were inserted through the right femoral vein. Electrodes at the end of the catheters are used to stimulate the heart and locate the area that is causing the abnormal heart rhythm. 3 linear lesions were made in the posterior and anterior right atrium. After 2 series of applied radiofrequency energy, no fibrillatory activity was recorded in the right atrium. To test the effectiveness, programmed atrial stimulation and atrial bursts were performed and no atrial arrhythmias occurred. 3 months after the procedure, there were no observable sinus pauses and no short-term complications other than slight pain at the sites of procedure. 3 linear lesions that divided the right atrial free wall surface into 3 different parts resulted in a clinically dramatic improvement in AFib. This study thus suggested that partitioning the atrial area may be more important than the location of the atriomites. Therefore, multiple techniques of catheter placement would be theoretically usable to treat AFib. In another study, researchers performed catheter ablation by pulmonary vein isolation. In pulmonary vein isolation, tiny scars are created in the left upper chamber of the heart in the area where the 4 pulmonary veins connect. Through the right femoral vein, a steerable catheter is positioned at the coronary sinus and an ablation catheter is advanced to the left atrium. During the procedure, the cavo-tricuspid isthmus is ablated and linear ablation is performed in the roof of the left atrium. Radiofrequency energy is delivered to the left and right superior pulmonary valve and the left and right inferior pulmonary veins. This graph here shows that for select patients with AFib, catheter ablation provided acceptable long-term relief from AFib. Although all of the reoccurrences of AFib emerge over the first 6 to 12 months, a slow and steady decline in AFib-free survival is noted, even after 3 or more years of apparent arrhythmia control. In a study conducted from 2003 to 2015, researchers looked at the AFib catheter ablation procedures and the complications that arose post-procedure for 1,475 patients at Johns Hopkins Hospital. They evaluated consecutively enrolled patients undergoing initial AFib ablation from and performed statistical analysis to identify predictors of increased risk for major complications such as death, stroke, phrenic nerve injury, and cardiovascular events requiring blood transfusions or procedural interventions. Major complications occurred in 3.9% of cases. Some of these cases were vascular access site hematoma, cardiac tamponade, cerebrovascular accident, or increased risk of complications associated with hypertension. As shown by the graph from 2003 to 2015, as the amount of AFib ablation cases increased, the percentage of complications decreased, and this was due to the growing experience of the institution. AFib can be very dangerous if left untreated. It has been linked to dementia partially due to multiple small strokes that can affect the memory centers of the brain. Only one previous study suggested that patients with AFib who underwent catheter ablation had a lower risk of dementia compared with patients who did not receive treatment. Other types of ablation techniques may be used, such as cryoablation, in which very cold temperatures destroy the problem area. A patient's doctor will decide which type of ablation therapy is most appropriate. Catheter ablations are becoming more important to study as it increases in popularity because once the tissue is destroyed, the abnormal electrical signals that created the arrhythmia can no longer be sent to the rest of the heart. However, as shown by studies, the effects can vary from long-term to short-term, depending on the type of procedure and health history of each patient. Not all AFib cases are preventable. However, by taking steps to avoid coronary artery disease or high blood pressure, people can help avoid developing AFib. A clean diet high in fruits and vegetables and low in fat, not smoking, exercising frequently, and managing your weight could help you keep a healthy heart.